Hey everyone, ready to dive into a topic that might help you see a little more clearly, pun intended. We're talking LASIK today, but not just in general. We're taking a deep dive into LASIK for farsightedness. So if you're tired of squinting at your phone or holding your book at arm's length, this episode is for you. We'll break down whether LASIK is actually a good option for farsightedness, how the procedure works, what the potential downsides are, and even what some alternatives are.
Exactly. The goal is to give you guys the information you need to make informed decisions about your eye health.
Okay, so we always hear about those amazing LASIK success stories. 99% of patients get 20/40 vision or better. I was reading that people even feel like their careers get a boost after LASIK just because they're more confident. But does that translate to farsightedness?
That's a great question. And like a lot of things in eye care, it's not a simple yes or no answer. LASIK can be really effective, but it's important to realize that not all farsightedness is created equal. We tend to think of farsightedness as one thing, but there are actually different
Oh,
types.
interesting. I didn't realize that.
Yeah, so you have the common farsightedness called hyperopia, which often comes down to the shape of your cornea. And then you have age-related farsightedness, presbyopia, which is all about changes to the lens inside your eye as you get older.
Okay, so it's not one size fits all. But before we even get too far into this, can you just remind me what causes farsightedness in the first place?
Of course. So imagine this. In a farsighted eye, the eyeball itself might be a little too short, or that clear front part of your eye, the cornea, might be a bit too flat. And because of that shape, the light that enters your eye ends up focusing behind the retina instead of directly on it. And that's what makes things close up look blurry, and it can even make things further away a little bit fuzzy.
So it's like the image is trying to project past the back wall of your eye instead of directly on it. No wonder things look blurry.
That's a great way to think about it. Now, because LASIK works by reshaping that cornea with a laser, it tends to be a good fit for farsightedness that's caused by the shape of the cornea. But when it comes to presbyopia, where it's more about the lens, LASIK may not be as effective.
That makes sense. Okay, so for those people where it is a good fit, walk me through what actually happens during a LASIK procedure for farsightedness.
Sure, so in LASIK surgery, a very thin flap is created in the outer layer of the cornea, almost like you're lifting a tiny flap on a box. And that's done using either a super precise laser or a very fine surgical blade. Then a cool laser, it's called an excimer laser, reshapes the cornea underneath the flap to correct the way light focuses in your eye. And finally, the flap is carefully repositioned and the cornea naturally heals on its own, so you don't even need stitches.
That is really amazing that technology can do that. But I imagine choosing to have any sort of eye surgery can be a big decision. What are some things that people should really be thinking about if they're considering LASIK?
You're right, it's not something to take lightly. Finding an experienced surgeon and having realistic expectations is super important.
Hmm.
Do your research, ask a ton of questions, and really don't be afraid to talk candidly to your doctor about anything you're concerned about.
Yeah, this is your vision we're talking about here. And speaking of being realistic, we've got to acknowledge that, like any surgery, LASIK does have potential risks. It's not a magic wand that guarantees perfect vision for everyone, right?
Right, exactly. While it's generally very safe and effective, there are some possible side effects like dry eyes, maybe some glare or halos around lights, or even some visual disturbances, but those usually go away as you heal. The key is just to make sure you have all the information so you can make a good choice for yourself.
Okay, so the side effects are usually temporary, which is good to know. What are some of the other options that are out there for people who are farsighted and want to improve their vision? If LASIK isn't right for them, what else can they look into?
Well, besides LASIK, there's actually a whole bunch of other options for vision correction. We've got other laser procedures like LASIK and epi-LASIK, and then there are options that use lenses like phakic intraocular lens implants, or IOLs for short, and then even refractive lens exchange, which is often called RLE.
Okay, whoa, that's a lot of acronyms. It's like a whole alphabet soup of eye procedures. Can you break those down for me and for our listeners who are hearing those terms for the first time?
Absolutely. Let's start with those other laser procedures. So LASIK, it's often a good choice for people who maybe aren't the best candidates for LASIK, like maybe their corneas are a bit too thin.
Okay, makes sense.
So with LASIK, instead of creating that flap in the cornea like they do in LASIK, what they do is they gently loosen the very top layer of the cornea. It's called the epithelium. And then they reshape it with a laser.
So it's a little gentler on the cornea, but I'm guessing that means the recovery is a little bit different too.
You got it. That's exactly right. Since we're not cutting a full flap like in LASIK, the recovery with ASIK can be a bit longer, and some people might have a bit more discomfort in those first few days after the procedure.
Yeah, that makes sense. So what about epiLASIK? Where does that one fit in?
So epiLASIK, it's another variation that's designed to be, again, a little gentler on the cornea. They use a special instrument to create a very thin sheet of cells from the surface of the cornea, and then that sheet is lifted up, the laser correction happens, and then it's put back in place.
Got it.
And epiLASIK, it often has a faster visual recovery compared to LASIK, but it might not be as effective for people with really strong prescriptions for their farsightedness.
So it's like each one has, its own pros and cons. It's about finding the right one for you.
Yeah.
Okay, let's talk about those lens-based options that you mentioned, the IOLs and the RLE. Those sound pretty different from LASIK.
They are. So phakic IOLs, these are tiny little implantable lenses that are surgically inserted into your eye. It's kind of like having a permanent contact lens, but you don't have to take it out every night.
Oh, okay.
The cool thing about these IOLs is that they can actually be removed or even replaced if they need to be. So it's a bit more of a reversible option compared to some of the other procedures.
Reversible. So you're saying that if down the line your vision changes a lot or something happens that you weren't expecting, you might be able to have that IOL taken out.
That's exactly right. And, with the laser procedures, we're permanently reshaping the cornea. So having that flexibility with the IOLs can be really appealing to some people.
Yeah, I bet that peace of mind is a big deal for people.
Are there any downsides to the IOLs?
Well, like any procedure, there are potential risks. With the IOLs, there is a small risk of developing cataracts down the road. But of course, your doctor would go over all of that with you in detail.
Okay, so always a trade-off. What about RLE? You said it was kind of like cataract surgery.
Yeah, that's right. So refractive lens exchange, or RLE, involves actually replacing your eye's natural lens with an artificial lens. And this is often a permanent solution, and it can address a wider range of vision problems beyond just farsightedness.
Oh, wow. RLE is especially helpful for folks who aren't good candidates for laser procedures, maybe because their corneas are too thin or irregularly shaped, or if their vision prescription is just too strong for the lasers to correct effectively.
So it sounds like RLE is kind of the big gun in the vision correction world, but with great power comes, well, you know the rest.
Yeah.
What about the risks and the recovery time with RLE?
You're right to ask. While it's considered generally safe, RLE is a more involved procedure than something like LASIK, and it does come with its own set of potential risks, just like any other surgery. And the recovery time, yeah, it's a bit longer compared to LASIK.
So again, not a decision to be made lightly. It really sounds like with all of this, choosing the right way to correct your vision is super personal. It's your eyes, it's your lifestyle, it's your comfort level, and of course, it's that conversation with your eye doctor that really matters.
100%. And that's what this whole deep dive is about. We're trying to give you the information so you can have that conversation. We often avoid this topic, but let's be real, these procedures can be kind of pricey. So how does cost factor into all of this? And is there a big difference in cost between all the options?
That is the million-dollar question.
Yeah.
Literally, in some cases, LASIK is definitely an investment.
Mm-hmm.
So do these other options cost about the same, or are we talking about a whole other ballpark? So are we talking about adding a couple more zeros to that LASIK price tag?
Not quite adding zeros, but yeah, you're right to ask about the cost. Generally speaking, LASIK, LASIK, and epiLASIK, those tend to be in a similar price range. They're all laser vision correction procedures, even though they've got their differences.
Makes sense, yeah. So those are kind of like the laser vision trifecta. But when we start talking about the IOLs and the RLE, are those a bigger investment?
Yeah, typically you are looking at a higher price tag for those compared to the laser procedures. They're more complex surgeries, often involve these tiny implantable lenses, and the technology is pretty sophisticated.
So kind of like comparing a really high-end sports car to a reliable sedan. Both will get you where you need to go, but the experience and the price tag are going to be pretty different. But even with the amazing technology and the promise of better vision, cost is a big factor for a lot of people.
What about insurance? That's the deal with insurance coverage for these procedures.
That's where things get a little tricky. Unfortunately, most insurance plans consider a LASIK and those other vision correction surgeries, they consider them elective procedures, not medical necessities. So it's like getting a gym membership for your eyes. It's great for you, but the insurance company doesn't really want to pay for it.
Exactly. As far as they're concerned, you're choosing to fix something that's not technically a disease. They'd much rather cover glasses or contacts, which costs less upfront for them.
Right, right. So Even though clearer vision can be life-changing, it's often seen as an optional expense. Are there any exceptions to that? Any secret handshake that we can use to get some help with the cost?
Well, there are a few things you can look into. Some employers actually offer vision plans that have discounts on laser vision correction or even partial coverage. So it's always worth checking with your employer to see what they offer. And then a lot of providers, they'll have financing options or special programs to try to make the cost a little easier to manage. So don't be shy about asking.
Right. Never hurts to ask.
Yeah.
Well, as we start to wrap up our deep dive here on LASIK for farsightedness, what's the big takeaway you want our listeners to remember?
We've talked about all the technical stuff and all the different options, but I think the most important thing to remember is that you have options. Farsightedness doesn't have to control your life. Whether you're leaning towards LASIK or you're interested in those alternatives, the most important step is talking to an experienced eye care professional. They can really evaluate your specific situation, they'll go over all the risks and benefits of each option with you, and help you make a decision that's best for you, your vision, and your life.
Couldn't agree more. It's all about finding that personalized approach. Well, there you have it, our deep dive into LASIK for farsightedness. We hope this has been helpful and maybe even a little eye-opening for you. And remember, knowledge is the first step towards clearer vision. Until next time, stay curious, everyone.